After I teach you this module, you shall be able to know more about community mental health, learn about mental health issues, identify mental health challenges, evaluate difference between signs of good and bad mental health, analyze the role of India towards mental health. What does mental health refer to? Mental health refers to the psychological state of an individual who is working at an optimal level of physical, emotional, and behavioral considerations. Mental health includes one's emotional, psychological, and social well being. It affects how we think, feel, react, and respond to certain conditions and circumstances. It also helps in determining how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Over the course of one's life, if one experiences mental health problems, his or her thinking, mood, and behavior could be affected. Many factors contribute to mental health problems, including biological factors such as genes, body or brain sequences, life experiences such as trauma, neglectance or abuse, and family history of mental health problems. Let us try to understand the cycle of mental health, which we will show diagrammatically. This is the positive or negative flow model. As you can see that our thoughts and beliefs are the sources of our feelings and emotions, which in turn are the driver of our behaviors and actions, which in turn give rise to consequences given by others, and finally these again are reinforcers of our belief system, which give rise to our thoughts and beliefs. What are the signs of mental health problems? Eating or sleeping too much or too little, pulling away from people and usual activities, having low energy, feeling like nothing matters, having sudden aches and pains, feeling hopeless and helpless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared, fighting with family and friends, experiencing severe mood swings that cause problems in relationship status, having persistent thoughts and memories that you can't get out of your own head, hearing and believing supernatural instances, thinking of harming oneself or others, unable to perform daily tasks such as taking care of the family or getting to work or school. Let's now talk about the good mental health indicators. Good mental health allows people to realize their full potential, cope with stresses of life, work productively, make meaningful contributions to their communities, and the ways to maintain positive mental health include getting professional help if you think that you need it, connecting with others, staying positive, getting physically active, helping others, getting enough sleep, developing coping skills, and mental health includes our emotional, psychological, and social well being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Like I said earlier, that there are many factors that can contribute to mental health problems: biological, life experiences, family history. If we talk about the types of mental health problems, we can see that the percent of youth who meet criteria for mental disorders, the anxiety disorders account for 31.9%, behavior disorders account for 19.1%, mood 14.3%, and substance use disorders 11.4%. The source for this information is Journal of American Academy of Child and Adolescent Psychiatry. Mental illnesses are of several kinds and degrees of severity. Some of the main types are depression, anxiety, schizophrenia, bipolar mood disorders, personality disorders, trauma, and eating disorders. The most common among the mental illnesses are anxiety and depressive disorders. Initially, individuals experiences strong feelings of tension, anxiety or sadness at times. A mental illness is present when these feelings become so disturbing and overwhelming that people encounter extensive difficulties in coping with day to day activities and ailments such as work, enjoying leisure time, and maintaining relationships. At their most extreme, people with a depressive disorder may not be able to get out of bed or care for themselves physically. People with certain types of anxiety disorder may not be able to leave the house or may have compulsive rituals to help them alleviate their fears. Less common are the mental illnesses that may involve psychosis. These include schizophrenia and bipolar mood disorder. People experiencing an acute episode of psychosis lose touch with reality and perceive their world differently from what is considered normal. Their ability to make sense of thoughts, feelings, and the world around them is seriously affected. A psychotic episode may involve delusions such as false beliefs of persecution, guilt, or grandeur. It may involve hallucinations where the person sees, hears, smells, or tastes things that are not even there. Psychotic episodes can be threatening and confusing to other people. Such behavior is difficult to understand for people who are not familiar with it. Let us talk about the mental health issues in India. Mental disorders affect 5 crores of the Indian population, which is approximately 5%, and need special care. 80% of our districts do not even have one psychiatrist in public service. WHO estimates of 2001 indicate a prevalence level of about 22% of individuals developing one or more mental or behavioral disorder in their lifetime in India. According to WHO, countries like India devote less than 1% of their health budget to mental health compared to 10%, 12%, and 18% in other countries. There are just 3,500 psychiatrists in India. 3 psychiatrists per 1 million people in India compared to 100 in Australia and 150 in developed countries. Over 90% of people with mental illness are cared for within their communities by their families and may never even receive a diagnosis in their lifetime. The epidemiological situation and available health service system shows that providing mental health services in rural areas is a challenging task which needs infrastructural, architectural, and programmatic correction in the existing National Mental Health Program and district mental health programs. The mental health challenges that are faced in India are the need and treatment gap, the gross disparity between the number of mentally ill persons and the available treatment facilities and trained professionals is reflected in a large treatment gap in the community. Considering the limited or no service availability, the treatment gap is huge in rural areas. According to one estimate, even if all 3,000 psychiatrists available in the country are involved in face to face patient contact and treatment for 8 hours a day, 5 days a week, and see a single patient for a total of 15 to 30 minutes over a 12-month period, they would altogether provide care for about 10 to 20% of the total burden of serious mental disorders. Surprisingly, it is almost similar to the estimated treatment gap of 90%. The next challenge that we face is the lack of awareness and stigma. There are two aspects to the current lack of knowledge of the population about mental health. First are the existing beliefs and practices. These relevant and appropriate at different stages of the evolution of society are often not in line with the current understanding of mental disorders and mental health. Second, stigma is an important barrier to mental health care. The path that leads to stigma and discrimination is the traditional and religious belief system created in a socio-cultural barrier within the society. Third is complicated healthcare systems and unusual beliefs. This is one of the biggest challenges that India faces as far as mental health care goes. India is home to a contrasting approach among all types of healthcare. Not only are there other systems of healthcare other than modern medicine such as Ayurveda, etc., but also people approach religious places for help, such as faith healing, especially in the case of mental illness. Another challenge is the lack of trained human resources. Lack of trained human resources for mental health care and treatment is another challenge, considering few institutions available for mental health professional training. But institutions that do provide medical students and psychiatric students with good training are often trained only in mental hospital settings with inadequate training of general health workforce and lack of infrastructure for supervision in the community. Another challenge is lack of role of government. Major challenge is the lack of political commitment and realization that mental health work is an important aspect of our health system, which has far-reaching implications for the development of the country. There is a low political will of central and state governments and unclear plan of action and policy. The government expenditure on mental health is another concern where it spends just about 0.83% of its total health budget on mental health. There is also unavailability of mental health services. Unavailability of mental health services and lack of resources, particularly in terms of human resources, financial constraints, and infrastructure, are the major barriers which make access to mental health services in rural areas more difficult. The services available in urban areas are far and costly and difficult to utilize and access due to various reasons. Next, we're talking about the mental health literacy. The term mental health literacy is derived from the term health literacy. originally defined as a functional capacity related to basic literacy skills and how these affect the ability of people to access and use health information. In recent years, the definition of health literacy has expanded to include the development of increasingly complex and interactive cognitive and social skills which are related to personal and collective empowerment for health promotion. At the fifth WHO Global Conference on Health Promotion, it was noted that the health literacy is not only a personal characteristics but also a key determinant of population health. Mental health literacy has been defined as the knowledge and beliefs about mental health disorders which aid their recognition, management, or prevention. More recently, researchers have suggested that mental health literacy is not a single dimension but rather represents knowledge and beliefs about mental health disorders that emerge from general pre existing belief systems. Mental health literacy represents a relatively new area of investigation. Moving on to the cultural and social considerations. There are significant cultural variations in how people recognize, explain, experience, and relate to mental disorders and treatment. These variations are closely connected to social and environmental conditions. For most mental health problems, social context and related personal beliefs appear to be of significance in shaping the form, expression, and recognition of the disorder. Culture, you must agree, is highly influential in the experience and course of mental disorders. For example, depression often presents in the form of somatic symptoms in India, and it is well documented that schizophrenia has a better course of outcome. Stigmatizing attitudes towards severe mental illnesses such as schizophrenia seems to be common in India. Within and across cultures, social, economic, and political factors profoundly influence mental health. There are multiple socio-economic and environmental determinants of mental health and mental illness, just as there are for physical health and physical illness. Social determinants of physical health, including poverty, education, and social support, also influence mental health. Feelings of powerlessness and low self esteem are linked to depression, and in all countries, women and immigrant and refugee populations suffer higher rates of depression. Around the country, despite their diverse cultures, indigenous people have similar mental health problems, which diminish when they regain control of local governments, services, and cultural activities. Next are the traditional and religious beliefs. In India, the prevalence of mental disorders ranges from 10 to 370 per 1000 population in different parts of the country. The median conservative estimate of 65 per 1000 population has been given by the Guru Raj et al. The rates are higher in females by approximately 20 to 25%. As far as the causation of mental morbidity is concerned, there are many factors similar to other world community, but delayed health-seeking behavior, illiteracy, cultural and geographic distribution of people are very special and specific to India. Access to adequate mental health care always falls short of both implicit and explicit needs. This can be explained in part by the fact that mental illnesses is still not well understood, often ignored and considered a taboo. The mentally ill, their families and relatives, as well as professionals providing specialized care, are still the object of marked stigmatization. These attitudes are deeply rooted in society. The concept of mental illness is often associated with fear of potential threat of patients with such illnesses. Fear, adverse attitude, and ignorance of mental illness can result in an insufficient focus on a patient's physical health needs. The belief that mental illness is incurable or self inflicted can be very damaging, leading to the patients not being referred for appropriate mental health care. It is found that current treatment coverage ranges from 15 to 45% only, and there is therefore gross underutilization of services. Many factors contribute to such underutilization of services. The attitude of individual patient towards his or her mental disorders is very important as far as the health seeking is concerned. Adverse attitude towards psychiatry and psychiatrists has been observed among medical professionals, which could be another hindrance in providing adequate mental health services. It is pertinent to study the perceptions, myths, beliefs, and health seeking behavior for mental health of population. Difficulties in utilization of available services by the mentally ill, the practical problems faced by people with mental illness interested in continuing regular long term care include the long distance they have to travel to treatment facilities, the lack of a caregiver to accompany them, frequent non availability of medicines at treatment centers, changing professional team members, lack of availability of rehabilitation services for those who have recovered, and difficulty of getting welfare benefits. The current system of cross sectional care in clinics, with an emphasis on drug dispensing, should shift to coordinated total care in the community. That is, imparting skills for self care, formation of self help groups, integration and non discrimination. The families, that is, networking of families imparting skills for care and rehabilitation and provision of support through mobile phones. And voluntary organizations, that is, raising public awareness, providing support to families and rehabilitation. The focus should shift to cure, recovery, and reintegration rather than only dispensing medicines. Need for multifaceted intervention for long standing illnesses. Medicines can be adequate for the treatment of acute episodes. However, for the large majority of patients with long standing illnesses, there is a need for a multifaceted intervention that involves the family, community, and voluntary organizations and is aimed at rehabilitation and reintegration. Since all these cannot be organized by public health services, there is a dire need for specific programs to support families and voluntary organizations. Next in the line is stigma. Stigma and discrimination because of mental illness are still major obstacles to the development of mental health services, to the rehabilitation of those impaired by mental illnesses, and to an investment into mental health research. Lack of awareness and recognition of CMD, which is the common mental diseases, with prevailing stigma and discrimination, is an important issue and a barrier which is closely associated with low literacy in rural areas. The path that leads to the stigma and discrimination is the traditional and religious belief system, creating a socio-cultural barrier across the society. Another barrier is resistance to decentralization and resistance by mental health professionals and workers whose interests are served by large hospitals. There are difficulties in integrating mental health in primary health care. Primary healthcare workers are overburdened with lack of supervision and specialist support. As there is an uneven proportion of the number of patients and the psychiatrists available, the condition and quality of treatment provided is compromised. Another important barrier is mental health leadership of the country, which often lacks public health skills. Those who are in the leadership positions are psychiatrists trained in clinical management without formal public health training. To summarize it, the mental health services are a neglected area which needs immediate attention considering the burden of disease and treatment gap. District mental health program needs restructuring and convergence within the NRHM. The extension clinic approach needs to be replaced and integration of mental health services with general health services, particularly under the NRHM. The first type does not deserve to be called hospitals or mental health centers. They are dumping grounds for families to abandon their mentally ill member for either economic reasons or a lack of understanding and awareness. This lack of understanding and awareness is about the mental illness afflicting their family member. The living condition in many of these settings are deplorable and violate an individual's right to be treated humanly and live a life of dignity. Despite all advances in treatment, the mentally ill in these hospitals are forced to live a life of incarceration. The second kind are those that provide basic living amenities. Their role is predominantly custodial and they provide adequate food and shelter. Medical treatment is used to keep patients manageable and very little effort is made to preserve or enhance their daily living skills. These hospitals too are violating the rights of the mentally ill persons to appropriate treatment and rehabilitation and the right to community and family life. Ironically, it is in urban areas where medication and psychiatrists are available, but in rural areas, medication is not available, nor are the psychiatrists. The primary health centers don't stock medication, and a huge population of people with major mental health illnesses don't have the basic access to either treatment or medication. However, in a rural village, a patient suffering from schizophrenia is assimilated within the culture without a lot of discrimination. But when these villages become towns, there is a decreased tolerance to these psychiatric illnesses. Gender bias also aggravates the problem. The joint family system had assimilated and provided care for many of the mentally ill in their homes. But With increasing nuclear families, care provision demands more resources. Thus, India, without a massive mental health movement, will see a lot of homeless patients in future.